In times of emergency, one must check their scene first, check for any hazards or if there are any clues as to what happened to the situation. So right now, I'm seeing no witnesses, nobody, just an old woman lying unconscious. So before I proceed, I need to wear any sorts of gloves, face mask, donning, or if there are no gloves available, I have to sanitize my hand with some sanitizers before approaching the victim to avoid contamination. So, hey, are you okay? Hey, are you okay? I tap the shoulders, none. It seems to be that our patient is unconscious. Patient is unconscious, and I have no need to move her unnecessarily since her position is perfect enough. Her back is faced against the wall, and doing so might cause any further damage. So now I'm gonna perform implied consent. So hey, my name is Delvrandou Tapusok. I'm a first year PT student from Velez, and I have enough medical training to know how to help you. So it seems to be that you are unresponsive, and I'm gonna do my very best to put you in a better state of consciousness, even if it means that I have to perform CPR. So I'm gonna need your consent. I'm going to help you, okay? Now I'm going to check you for any signs of severe bleeding now. Please bear with me. So now I'm going to perform checking for any severe bleeding from a patient from head to toe. So head, upper limbs, torso, legs, none. There are no signs of severe bleeding. That means I would have to call for emergency services first. So call, dial 911, emergency hotline. 911, what's your emergency? Hi, there seems to be an emergency here at the park. There seems to be a 65-year-old woman who suddenly collapsed and is now unconscious. I have checked her. There's no signs of breathing. There's no signs of severe bleeding, and I have yet to check her for any breathing. Right now we're at the park, all alone, no witnesses, just me. My personal number is 0928342835. I'm going to perform CPR on her in case if I don't see any signs of breath, okay? Once the call has been made, then I'd have to position her in a way that I would be able to thoroughly check her for any signs of airway blockages or any signs of breathing problems. So to do that, I need to do head tilt chin lift technique. But before I would do that, I need to keep in mind that she has no spinal problems, else it might complicate. But since she has none, then I'd be able to perform it naturally. To do that, forehead, one hand on the forehead, 2 fingers on the bottom bony part of the chin, use it to lift up. From this way, I could now check her airways, breathing, and circulation. To do that, I need to put my ear near her breath and carefully watch as her chest rises to see if there's any signs of breath, or hear or feel any signs of breathing coming from her mouth for 10 seconds. But unfortunately, my patient does not seem to be breathing or her chest to be rising, so now I'm going to perform manual CPR. To do that, I have to position myself with my center at her shoulder level. Please use my heel from one hand to the center of her chest with one hand above it, and perform 30 compressions, 2 inches deep for 100 to 120 compression rate. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once that's done, recovery breath. Use breathing barrier. Head tilt chin lift technique. Pinch her nose, then provide 2 recovery breaths. Breathe for 1 second. So 1, 2. After that, you need to perform the 30 compressions again and 2 recovery breaths. Once more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 4, 25, 26, 7, 8, 9, 30. 1, 2. Continue doing so until either EMS arrives or if the person becomes consciousness. In this scenario, the person becomes suddenly conscious, she regains her breath, and now I'm going to put her in a recovery position by placing her body sideways, supporting her back and her back of her head and her body. I now lift her sideways. And I'll be with her until help arrives.